I think a lot of seniors are getting ripped off, says Congressman Mark Pocan. Many seniors don't know the difference between Medicare and Medicare Advantage. They don't understand that it's not really the government program they paid into. To prevent insurance companies from preying on seniors and marketing their plans as Medicare, Pocan is taking action. His dedication to progressive policies will be on full display when he reintroduces the Save Medicare Act. He cites his support for the bill as an example of how progressives can continue to advance their ideals in a Republican-controlled House while also ensuring that Democrats are ready to act when they regain full control of Congress. Hello and welcome to 5 Pillars Health, the channel where we show you the best ways to get healthy and stay healthy through the 5 pillars of sleep, hydration, nutrition, movement, and sunlight. We fundamentally believe in the right to good health here at 5 Pillars Health, obviously. We feel that each and every one of us should have full access to the healthcare we need, if we need it, and we should all take our own personal actions to improve and maintain our health. We also are promoters of good natural health ideals, as you can see through our 5 pillars of sleep, hydration, nutrition, movement, and sunlight. As we age, our health needs change, and we all need access to different things in order to maintain our health. In this video, we're going slightly off our usual topics related to using the 5 pillars to treat or improve your health, and we're straying mighty close to some sensitive political topics. Please keep in mind we're focused on good health for everyone, regardless of political ideals. With that in mind, let's look a little closer at the proposal for change. The bill in question is aimed at Medicare Advantage plans, which Pocan and his supporters claim have been turned into a money grab for insurance companies. The program, in which private insurance companies provide healthcare coverage options as an alternative to traditional Medicare, was originally intended as a cost-cutting measure to encourage insurance companies to provide seniors with healthcare coverage at a competitive price. A Medicare Advantage plan now covers nearly half of all Medicare-eligible Americans. According to a recent New York Times analysis, multiple lawsuits have documented how private insurance companies seek to overdiagnose Medicare Advantage enrollees in order to receive more money from the federal government. According to the Times, 8 of the top 10 Medicare Advantage providers submitted inflated bills to the government. The cost of Medicare Advantage overbilling in 2020 alone is estimated to be between $12 billion and $25 billion. If you're liking this video, we'd really love it if you tapped the like button. Those like Pocan, who have campaigned to expand traditional Medicare to include dental, vision, and hearing coverage, are outraged by the wasteful spending. According to Congressional Budget Office estimates, the cost of Medicare Advantage overbilling could cover the cost of expanding Medicare. This has become an additional profit center for these companies, when that could have actually gone towards enhancing Medicare, Pocan said. The Save Medicare Act would prohibit insurance companies from using the term Medicare in plan titles, making it theoretically easier for seniors to differentiate between traditional Medicare and private offerings. Companies that attempt to engage in the marketing practice would face fines under the bill. Pocan's mother, in her early 90s, was once unable to receive care because her Medicare Advantage plan required her to travel to a doctor's office in her neighborhood. A medical provider could have come directly to her assisted living facility under traditional Medicare. If you enjoy our channel, please consider subscribing. The Congressman recognizes the numerous obstacles that the Save Medicare Act will face before becoming law. In Washington, private insurance companies have a strong lobbying presence. However, he believes that there is a chance for bipartisan cooperation on the bill, especially if more seniors like his mother share their experiences with the program. Even if the Save Medicare Act makes it to the president's desk, Congressman Pocan predicts that its passage will be the exception rather than the rule. He predicted that House Republicans would be ineffective when it came to passing legislation. That impression grew stronger after witnessing last month's bitter battle for the House speakership, which ended with Kevin McCarthy winning the gavel on the 15th ballot after a days-long revolt staged by 20 Republican conference members. If this video is helping you, please share it with someone who could benefit too. Pocan contended that progressives in Congress can still make the most of the next 2 years. Although Democrats lost the House in November, progressives expanded their ranks with the addition of new members such as Florida's Maxwell Frost, Texas' Greg Casar, and Pennsylvania's Summer Lee. Pocan saw these candidates' victories as an encouraging sign that progressives' message is reaching voters across the country. If you've got a topic you want us to cover, please let us know in the comments. We want to bring you truly helpful videos that can improve your health and life. At 5 Pillars Health, we don't particularly care for politics, but when it impacts people's ability to live happy, healthy, and fulfilled lives, we sit up and listen. What do you think of all this? Drop us a comment below to join the conversation. We'd love to hear from you. Think someone you know could benefit from this video? Please share it with them. Share the gift of health.